Gynecology in Turkey is highly sought after and in high demand by foreigners in need of medical care. Women deliberately go to Turkey to take advantage of the high-quality services of local gynecologists at affordable prices. Couples with fertility problems adjust their plans and schedules to undergo artificial insemination in Turkey and give birth to a child here. This video is about a specific direction of gynecological care. The problem addressed by this approach is not often discussed, but it is common. Urinary incontinence in women. We'll see a doctor who solves this issue in Antalya, Turkey. High-quality gynecological procedures, low prices, and the opportunity to combine treatment with relaxation in a pleasant climate. That's what attracts foreign patients to Turkey. To tell you about gynecology in Turkey, I met a doctor who has been treating women from other countries for many years.
Professor Işıl Kölelı, obstetrician-gynecologist with more than 20 years of experience, graduated from Ankara University. She has worked in a maternity and private hospitals in Istanbul, 2 years in a urinary gynecology clinic in Dortmund, Germany, taught at the Department of Urogynecology and Reconstructive Pelvic Surgery at Inonu University, author of an articles in serious international medical journals, opened an outpatient clinic in Antalya Education and Research Hospital, performs surgeries in ISO and JCI accredited international hospitals in Antalya, and sees patients in her own clinic, where she met me.
You specialize in treating urinary incontinence in women. How frequently does this disease occur? At what age does he most often manifest himself? And what percentage of women, in your opinion, suffer from urinary incontinence? Urinary incontinence affects every third woman aged 45 or older and every second woman aged 60 or older. It is a common condition that many women experience. First of all, after examining our patients, we determine what type of incontinence they have. Do all women who suffer from urinary incontinence need to be treated the same way? Or are there different approaches, different treatment methods? We divide patients into 5 groups, and in each group we treat urinary incontinence differently. However, among these 5 types, stress urinary incontinence is considered to be the most common. Its cause is the degeneration of the pelvic floor. The muscles of the pelvic floor can be damaged due to pregnancy, childbirth, menopause, and smoking. Incontinence can happen during coughing, laughing, physical exertion, or during intercourse. The treatment of stress incontinence involves correcting the anatomical structure and is typically accomplished through surgical intervention procedures. And if the patient simply has to go to the toilet frequently, we refer to this type of incontinence as urgent calls, arch incontinence. There are medical methods of treatment, but it is also important to do exercises to strengthen the pelvic floor muscles. This is a Kegel exercise. Patients have the ability to perform them independently. Now please tell me how you treat urinary incontinence in women. Describe the process step by step, as detailed as possible. Surgical intervention is frequently necessary for urinary incontinence. These procedures are commonly known as sling operations. As you know, urine from the bladder exits through a special channel, the urethra. There is a narrow urethrovesical angle between the bladder and the urethra. However, when the tissues supporting the urethra are damaged, this angle widens. We conduct sling operations to narrow it once more. The duration of the sling operation ranges from 30 to 40 minutes. The procedure is carried out under spinal or general anesthesia. The patient is discharged the day after, but it may take an additional 2 to 3 weeks for the condition to fully return to normal and for the woman to resume her normal life without experiencing any pain or discomfort. You have the option to travel as early as 2 days after the surgery. Naturally, every surgical procedure carries risks, including sling operations, but such occurrences are extremely rare. I have conducted around 2,000 sling surgeries, and none of my patients have ever encountered any major side effects or complications throughout the entire course of their treatment. How many times does the patient need to come for an appointment with the doctor? To receive full treatment, the patient just needs to come to the hospital 3 times. The first visit is for examination and consultation, the second visit is the operation itself, and the third visit is for examination the next day after the operation. Duration of treatment, number of patients for clinic.
length of stay in city after treatment, and most importantly, how do you assess treatment efficacy? After urinary incontinence surgery, the patient stays in hospital for just 1 day. For example, the lady came to Antalya and is having a good time. She can visit our clinic in the last days of vacation. If a woman requires surgery, we'll arrange it. Patients have the operation and she stays in the hospital overnight for observation and recovery. We will evaluate her condition in another 2 to 3 days, and following that, she can go back home. We monitor the effectiveness of treatment, conduct several surveys, and based on the results of these surveys, we can objectively assess whether the problem has been resolved or not. Why should foreigners come to Turkey for urinary incontinence treatment? What are the advantages here? We operate in internationally accredited hospitals. Our operations are great and the nurses are highly experienced. I am a very experienced doctor in urinary incontinence. I've practiced urogynecology for over 10 years and performed thousands of surgeries, including overseas. I worked at a urogynecology clinic in Germany. We have an experienced team.
From which countries do patients usually come to you? We reside in Antalya, and here the population that speaks Russian is in the tens of thousands, so a significant number of our patients are Russian-speaking. We also have patients from Germany, predominantly Turks living in Germany. Additionally, we have patients from England and Egypt, and there is a group of patients from Turkmenistan, Tajikistan, as well as Azerbaijan. Many patients from Dubai and Saudi Arabia. The population of Turkey is large, and doctors see many patients, so we have a lot of experience in the field of healthcare. Our hospitals are typically high quality, offering excellent treatment opportunities and professional development for doctors. The video description includes procedure cost, reception, airport pickup, hotel accommodation, and language-speaking assistance. Turkey stands out from other countries with its comprehensive approach to patient care, where each procedure has to be paid for separately. The company Healthy Turkiye, which works only with verified specialists in both medicine and hospitality, is responsible for organizing such an all-inclusive trip and coordinates all their work for each patient. Healthy Turkiye takes care of everything, from consultation and agreements with the clinic and doctor to transfer, accommodation, immigration formalities, and translation of medical documents, and even rest between doctor's appointments. The company's website address is on the screen. This site has a lot of information on other areas of health tourism. You can use it as a reference. Contact this number for consultation. Don't forget to subscribe to our channel and don't miss new videos about medical tourism in Turkey.